They already decided what they want to do with us, and they didn't propose us. They just let us know what their decision is.
Not feeling heard and taking a stand for what he believes.
Let's fight for a pop-up clinic.
Arifin Chowdhury says he won't be taking one of the 150 walk-in vaccination appointments open to the residents of Rebecca Towers at First Ontario Centre over the next 3 days, hoping the city will still change its mind and provide an on-site clinic.
Everyone wants to get it on a door-to-door basis.
Despite that, the tenant committee says it will work with the city to support the plan, as many residents want access to the vaccine now.
Many people are eager to get the vaccine as soon as possible. They're very scared. They're living in fear.
Emily Power of the Rebecca Towers Tenant Committee says residents are grateful for the access, but for people with chronic illness, people with infant children, and the elderly, First Ontario is not a good option. She says a combination of door-to-door vaccinations for the most vulnerable and an on-site clinic for the rest is a better plan, and it's been done at apartment buildings in Ottawa and in Toronto's Jane and Finch neighborhood.
Nurses and paramedics were able to deliver more than 3,000 vaccines to residents in one weekend.
Public Health has said it doesn't have the resources to do apartment pop-up clinics. However, Public Health will offer some on-site vaccination door-to-door for homebound people. But residents say the definition of homebound seems vague.
Kind of unclear for us who are eligible for homebound.
The city says a similar vaccination plan is in the works for residents of Wellington Place and the Village Apartments, which are also in outbreak. But residents there want pop-up clinics too, and management have said they would provide space and staff.
They have many barriers.
Suad Badri and her 2 sons live at the Village Apartments, where she says there are many newcomers to Canada, racialized people, and low-income frontline workers. Badri believes an on-site clinic would help overcome barriers like language, digital literacy, cultural differences, transportation, and vaccine hesitancy.
They're getting a lot of misinformation.
She says an on-site clinic would allow familiar community leaders from the building, including herself, to be present to encourage residents to go.
The best way out is to have it here at the building.
Public Health says it has hired vaccine ambassadors from diverse backgrounds to go door-to-door to encourage vaccination. There are 109 cases at Rebecca Towers, 34 at the Village Apartments, and 22 at Wellington Place. Matt Ingram, CHCH News, Hamilton.